Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. We decided to continue on venereal disease today, and we take up gonorrhea.
Yes, sure.
Very good.
See, as we have discussed last time also, these venereal infections, they spread because of intimate contacts, especially mucous membrane to mucous membrane. And similarly, as we discussed syphilis, gonorrhea is also very common sexually transmitted disease.
Which is more serious?
They are serious in their own right, depending upon the host who gets it. Because we have seen in syphilis also that there are people who get it, they develop primary chancre, they develop secondary syphilis, and sometimes it gets arrested in that phase for the whole life. It may remain silent for the whole life, though it may spread to others, but the person may not suffer from it, barring some local disorder. And there are people who come down with serious illnesses, irreversible pathologies with the same disease, where it becomes fatal. Like we have seen cases with aortic aneurysm getting burst open. So there are fatal. Same way gonorrhea also. This is mainly a variety of diplococcal bacterial variety, which infects, and it's a highly infective type where there is a close intimate contact between the infected person and the person who is going to receive it. Because sexual contacts are most intimate contacts, it is said as a sexually transmitted disease. But even without that also it can spread, definitely. But we have seen that in its presentation, the gonococcal infections come in acute form. And the presentation would be different in different persons, depending upon, like if it is a female. Now if female gets infected, somehow the vaginal passage and urethra, though they are like closer to each other, but they are independent. So the infections go very silent, asymptomatic. Females don't develop any major symptom. Almost 80% cases of gonococcal infections in female, they go unnoticed.
Nothing visible.
Nothing visible,
body
and directly it goes on spreading. And this is another infection where it doesn't get cured by itself. Body itself can't cure unless there is again an external intervention. Body can control it. Body can just control it and confine it to one space. But it can't be eradicated by the body itself. In these infections, we have seen that along with the local inflammatory changes, what we call commonest is pelvic inflammatory disease. In pelvis, in females, they get it, and with this disease they develop a lot of inflammatory changes in the generative organs, like fallopian tubes get blocked, or they may develop like so many ectopic gestation type complications, or they get even abdominal pain, severe. It's a painful situation. They get urethritis where burning micturition is there. But we have seen in males, it is always developing quick symptoms, because in males the urethral passage, urine passage, and the generative organ passage is just same, and therefore they get infected very easily, apparently, and symptoms are evident within 4 to 5 days. So in the very first week of infection, they develop symptoms in the form of urethritis and all. And these infections become chronic if there is a temporary relief with.
Is it visible in the organ also?
Yes, it's visible. Not only that, it starts getting even pus discharge per urethra and purulent discharge. So almost like 90% cases, the symptoms surface, unlike females. And then it becomes a chronic thing. It causes urethritis. Then when urethritis comes, there is always a scarring when the ulcerations heal, and then there would be a stricture urethra, or the passage would be blocked. So then there would be even cystitis also, like even bladder mucosa also gets infected.
And you say this occurs usually very quickly, 4 or 5
Yes,
days?
yes. Within first week, it starts giving symptoms, and then it can become chronic. It can become chronic, and then it can invade everywhere in the body. It can have a local spread, as well as it may even enter into bloodstream, and then through that, though, it can spread anywhere. Like we know, we have seen very common complications of this, like endocarditis. So even the inner lining of the heart chambers, that also gets affected, leading to valvular disorders and all. So it can lead to any organ. Funniest thing I'll tell you, in homeopathy we prepare medicine from this organism. We call it medorinum. The medicine is prepared from the gonococcal infection. Nosode, what we call it, is for the disease product we use. And we had one patient, and coincidentally the former DGHS, Director General of Health Services, from allopathic side I'm talking, it is the highest post in India in health sector, and he was with us that day. And looking at the X-ray, and that calcaneum spur X-ray was there, and the person had calcaneum spur, where the calcaneum bone becomes sensitive and the person just can't walk even one step without pain. So I just prescribed after taking the case. In homeopathy, what we do is we just tally the symptoms of the person with the symptoms of the remedy. And I prescribed this drug medorinum. And then before the medicine was packed and submitted, I just asked this allopathic expert, like, doctor, like, can you tell me why does this calcaneum spur come? Then he said there are so many theories. Like one is medial fascia muscles become placid, and therefore the calcaneum gets the brunt of the weight. But there is one hypothesis that the gonococcal organisms, they also can cause this calcaneum spur. This is known. And then I showed him the prescription what I have given. This is a symptom similarity, you see.
Ah,
Because it is medorinum is a drug prepared from gonococcus, and that is proved on healthy human beings, and that provings give symptoms similar to this gonococcal infection symptoms. Though it is an artificial disease and it reverses, but there are possibilities that each and every part of your body can get infected. Like we have seen during deliveries, if the female has this gonococcal infection in vaginal passage, during delivery the newborn gets infected with that, and at the time of birth we have seen, like very next day or third day, we get conjunctivitis, which is because of gonococci. So neonatal conjunctivitis mostly comes because of gonococcal infection. So it is quite possible that at the time of birth also person may catch the infection. It is not necessarily sexually transmitted disease. In the close vicinity, because the eye mucous membrane comes in close contact with the vaginal mucosa of the mother during the passage of delivery. And we have seen neonatal conjunctivitis caused by gonococcal infection.
but you say that gonorrhea is more curable than you, because you said syphilis was not really curable.
It's not like that. What I said was, like, gonococcal infection has a short incubation period as compared to syphilis. If the person is coming in contact with syphilis as well as gonorrhea, the gonococcal bacteria infection will emit symptoms within 1 week, whereas syphilis may exhibit symptoms after 3 weeks. And in that also, the symptoms are much milder. The primary chancre in syphilis is not painful at all, so person even may not notice. Whereas gonococcal infections become very apparent. They are painful, they are so evident that they are promptly attended.
And it's easier to treat when you can.
I won't say easier, but what happens like when they become apparent and then you start treating it. So, in the background, if syphilitic infection is during incubation period, and if talking from allopathic point of view, the penicillin injection course is given, which used to be common earlier for gonorrhea and syphilis. Only difference was that gonorrheal infections needed only some 10 days course, whereas syphilitic infection needs minimum 20 to 90 days of course. Now, what used to happen that if the person has gonococcal symptoms promptly surfacing and the physician promptly treats it, and then the primary chancre appearing in response to syphilis may not even surface. So, person it goes just unnoticed because of this short treatment of gonorrhea, and therefore the gonococcal infection might be treated promptly, whereas this becomes draped and it remains untreated till it goes to secondary and tertiary stage. In that sense, I would say it is detected earlier, it gets symptoms promptly because it is little painful also, especially in males. But I won't call it easy because the treatment would much depend upon not the physician's medicine. It would depend upon the reactivity or the response of the host person. We have seen the person reacting quickly and developing inflammation, and there would be prompt intervention, and person will get rid of it with little help and symptoms. We have seen some people who develop mild symptoms initially, they are treated promptly, but somehow it gets suppressed. We call it suppressed gonorrhea. If it is not treated promptly, it is just palliated, and then they develop deeper infections. Like I have seen a case where the gentleman used to get gleat. Gleat is some uh, abnormal discharge per urethra. It may not be pus, but it is a serious discharge. As a first part, every day before urination, person may pass gleat, which is non-specific, and person was he was tested for gonorrhea, the sample, urine samples, and it used to be negative. So I remember our teacher, it was a male patient, so he did a prostatic massage with a per rectum. He approached the prostate and he massaged it, and with prostatic massage there appeared some discharge from the urethra with this prostatic massage, and that discharge was collected and tested, and it became gonorrhea test positive. So many times it gets veiled, it gets draped in chronic form, but then he was treated promptly, and he was free of his complaints.
So, cure is possible in gonorrhea.
Yes, cure is possible even in syphilis, but not a spontaneous cure. Needs external aid. In this sense, gonorrhea becomes easier because it becomes apparent easily in the primary phase, and therefore the person also seeks intervention from physician. Whereas in syphilis, the person doesn't have any acute complaint, so may not even approach for intervention. In that sense, gonorrheal infections are easy to tackle.
Are there any other venereal diseases to
There are,
discuss?
yes, but there are of course 7 8, and now the new one for last 25 years is this HIV.
HIV, yes.
HIV. So, but and transmission wise, it has similarity. But
Exactly.
in the background, we have to understand this, that HIV is something which fiddles with your basic immunity. It lowers down your immunity response. Whereas this gonococcal infection, this gonococcal or even syphilis, spirochetal, it invades into your system and goes on affecting the different tissues one by one. And if it has a coincidence of HIV, then the things become worse. Things
Yes,
become
of course.
worse in the sense the person's basic immunity is compromised, and with that background, all these diseases they thrive like anything. They get so much freedom to thrive that they get least resistance from the person. Earlier, you see, that is what even the modern medicine people started realizing the host basic immunity. Because earlier they used to still give you antibiotics and infection will be controlled. But now we have seen with the incidence of HIV, we realize that all these opportunistic organisms which were otherwise not able to cause any disease, they also cause serious ailments because the person's immunity is compromised. We call them opportunistic infections, where in general conditions they won't be able to affect in any way, but whereas once the immunity is compromised, then they start developing symptoms in the person.
Well, thank you very much. A wonderful session. Thank you.